So who told you that we are running out of vaccines? Because you want to believe this. You want to paint this country black. Now, a country which lacked any infrastructure has successfully done 140 million vaccinations. And you think that's not an accomplishment? I mean, I am amazed that what kind of mindset with which you want to fight this pandemic. I mean, India should have been applauded for the fact that while the Western world has been able to find out a solution, we were also along with them to find our own solution for the pandemic, corona pandemic. 1 lakh centers from where we are administering these vaccination points. Is this small? These are humongous operational parameters. No country will match these parameters. But that's that apart. We have challenges, and we as a nation are addressing these challenges. You said that the Prime Minister said everything is going towards normalcy because, yes, there was a time when the corona cases had really drastically declined. Now we are treading in unfamiliar territories. There are no precedences to corona in this entire world.
Well, Dr. Lancelot Pinto is a pulmonologist and epidemiologist based in Mumbai. He joins us now via Skype. Sir, thank you so much for joining us here on Al Jazeera. We were just hearing the views there of a senior leader of the governing BJP party speaking to us a little bit earlier about vaccination, effectively lauding as one of the best in the world, certainly by number, if not percentage of the population. Then on the other hand, we have the chief executive of the country's largest vaccine manufacturing saying the shortage will last for several months. So who's right?
So I think we have had challenges with the vaccination program over the past few weeks. I do know that people who've wanted to get vaccines on a particular day at some point have had to wait, have not got it on the day of their choice, have not got it on the day of the schedule. To a certain extent, he is right. It is a huge endeavor to vaccinate a country as big as India with the population that it has. But I think most of us feel that we haven't picked up at the pace that we should have by now.
Again, Sudhanshu Mittal from the BJP was saying that India had, at least by numbers, one of the best vaccine campaigns in the world. I'm speaking to you from the UK, which is usually lauded as one of the countries that's also had a very, very good vaccine campaign. But that went hand in hand with a lockdown that lasted for months and is still kind of ongoing now. So do you think that India can try to stop this wave that we're seeing without more serious lockdowns?
So I think we need to be prudent about the way we do things forward. I think we let our guard down in the past. I think we've had gatherings of individuals where potentially the virus had a chance to spread more efficiently and rapidly, coupled with the fact that we are also dealing with a mutant which seems to be a lot more infectious than the earlier strain of the virus. So I think these combinations of letting our guard down, coupled with a really contagious virus is what has probably got us here. And I think we need to be really cautious about how we take things forward.
Well, tell us a little bit about the situation that you're living through in Mumbai. Is the situation as bad as what we're seeing in Delhi, for example?
So the situation in Mumbai, fortunately, doesn't seem to be as bad as some of the visuals that we ourselves in Mumbai are seeing from the rest of the country. We've had our challenges, we've had our moments of anxiety, and we've wondered whether we would run out of oxygen at different points of time. But fortunately, it hasn't happened. Fortunately, we haven't had to make any clinical decisions which have jeopardized the health of our patients, and we haven't had to ration oxygen at any point of time. We've, of course, been judicious. We've, of course, been prudent in the way we use oxygen. We down-titrate patients whenever we get a chance and see clinical improvement. We've switched over to non-pipe means of oxygen, such as concentrators, wherever we can. But I honestly haven't dealt with a situation where I have seen a patient losing his or her life or not getting the care that he or she deserved because of a lack of oxygen in a timely fashion.
Of course, it's not just the lack of oxygen that is proving to be a problem in India, a lack of a lot of other things, beds and, crucially, healthcare workers in many places. How do you see that developing as the contagion keeps expanding?
So I think it's clear that our healthcare infrastructure has been stretched to its limits. I don't think any one of us expected a problem of this magnitude. And we clearly weren't geared enough to deal with this surge We thought that the worst was over last year when we had a reasonably large surge and our healthcare system was stretched to its limits. But unfortunately, this has created a new normal or a new maximum limit to which we can be stretched. And clearly, we aren't prepared. And I don't think it's so different from the rest of the world, which also wasn't prepared under certain circumstances when the surges have been of this magnitude.
Sure, although that did tend to be at the start of the pandemic in most countries. But let's focus on another issue that seems to be growing in India, and that's the black market. So both for oxygen, for which we know there's a huge demand, and also drugs. How do you see that potentially becoming even more desperate situation, but also some of the problems inherent with getting drugs on the black market?
So I think that has been a problem for us clinicians as well. We do see a lot of therapies being pushed really hard, which are coming from a sense of desperation, which are not necessarily evidence-based. There are drugs which are being touted as being game changers or lifesavers, which we know for a fact aren't necessarily or haven't necessarily been proven to be that great. This has created a kind of an artificial shortage. We see messages on social media. We see messages everywhere out of desperation trying to look for these drugs. And again, these drugs, the demand for these drugs are clearly outmatching their supply. And that's leading to a black market in which the drugs are possibly being sold at higher prices than what they should be.
But are you seeing a problem that some of these drugs may not even be what they're claiming to be?
I think that's a huge problem. So I'm part of an initiative, a collaboration across the world, which we've tried to formulate a set of simplified guidelines for individuals. It's a website called indiacovidsos.org, where we have a simplified set of guidelines debunking a lot of these drugs that have gained a lot of prominence, which they shouldn't have, and are leading to a lot of desperate pleas from patients and relatives when they see their loved ones in an unfortunate situation. Creating an artificial demand for these drugs, which shouldn't really be there.
Dr. Lancelot Pinto, pulmonologist and epidemiologist based in Mumbai. Sir, thank you for sharing your expertise and experience with us. Thank you.